when we do the public comment period, but if you are listening by phone, you're going to press *6 to unmute your line or *5 to raise your hand. And again, we will repeat that towards the end of the presentation, so nothing to worry about. And then I would like to hand this over to our partners, Minette, and I will hand it over to Allie. Thank you.
Thank you so much, Michael. Hi, everybody. My name is Allison Garza-Monday. As Michael mentioned, I'm a senior manager with Minette. We're part of the team that's helping Nevada with this Section 1115 reentry demonstration. With our time today, we plan to provide you with a little bit of background on the Section 1115 waivers more generally, as well as we'll then turn to doing a specific overview of Nevada's proposed approach. And then, as Michael said, we'll ensure that there is time at the end of our presentation to hear from you all with your comments or questions related to the information that we present today. Next slide, please. So again, for today, we'll give you an overview of Nevada's ongoing efforts to improve care for individuals, both adults and youth, who are transitioning from correctional facilities into the community. We'll review the key components of the state's reentry waiver demonstration, and we'll receive your comments on the proposed approach. Next slide, please. So just to be sure that everyone is tracking where you can find additional information and the full details on Nevada's reentry demonstration, we've listed those web pages here for your reference. You'll be able to find the complete reentry Section 1115 application with all of the details there for your review, as well as required public notices. Next slide, please. So just a reminder and level setting for submitting public comments. DHCFP, the Nevada Medicaid agency, opened the comment period about a week and a half back on October 24th. That public comment period will be open, as you see here on the slide, through Sunday, November 24th. So we encourage you all to please submit comments and to ensure that those comments are received no later than 11:59, so before midnight on Sunday, November 24th, so that we can assure that they are taken into account and responded to and recorded for the purposes of the application. You can submit your comments in a number of ways as indicated here. You can send comments via mail to the mailing address that you see here on the screen. You're also welcome to send your comments via email to 1115waivers@dhcfp.nv.gov. And again, as noted here on the slide, please indicate Section 1115 reentry services demonstration in either the address line or the email line so that we can be sure that those are getting routed to the appropriate individuals. And then again, as noted, we will take comments during today's webinar. So all of the comments or questions that are received through the chat box in the Microsoft Tools toolbar there will be recorded as public comments. And then we will also provide the opportunity to verbally share public comments during that period at the close of our presentation. Next slide, please. So we'll start with some background, and you can move us to the next slide. First, just generally a bit of information for you on Section 1115 demonstration waivers by way of background. So federal rules put forth minimum requirements that relate to state Medicaid and CHIP programs, eligibility, and required benefits. By using Section 1115 demonstration waivers, states can request to waive some of those federal rules, and this in turn allows them to have more flexibility to design and improve programs in order, in some cases, to offer coverage to more people. Demonstrations must be experimental, pilot, or demonstration projects in nature that are likely to assist in promoting the objectives of the program. They are time limited. They're usually 5-year agreements, but states do have the option to renew demonstrations, and they can also seek to change or amend existing Section 1115 demonstrations to refine their approach. Lastly, demonstrations require additional reporting to CMS and do have an evaluation component in order to show the waiver's effectiveness against the proposed hypotheses and goals of the demonstration. Next slide, please. So last year, the Center for Medicare and Medicaid Services released what they is termed a state Medicaid director level. It's information to states on how they can design these demonstration projects to provide services to justice-involved individuals before they're released into the community. And this state Medicaid demonstration letter, or SDML, describes at a high level the minimum requirements and the parameters of the Section 1115 reentry demonstrations, including around the key components on the screen. So those include the time frame of the pre-release services, the individuals and correctional facilities that are eligible to either receive services or to provide services, related eligibility and enrollment processes, which covered services can be included, and provide an option to states to seek capacity building funds. Next slide, please. In addition to the federal guidance, in 2023, Nevada passed Assembly Bill 389, or AB 389, which directs the Medicaid agency, DHCFP, to apply for a reentry demonstration waiver. The legislation put forward some of the components of the demonstration, specifying those requirements, including as they relate to the pre-release time frame, individuals eligible to receive services, the scope of those services, and which correctional facilities are eligible to provide them. DHCFP has developed remaining demonstration components based on those parameters. Next slide, please. So now to turn to the specifics of the reentry demonstration waiver that Nevada is putting forward for comment today. Next slide, please. So again, Nevada this is an overview of the demonstration proposal, seeking authorities to provide a targeted set of Medicaid services to eligible justice individuals within the 90 days prior to their expected date of release, if known. Beginning in October 25, the state intends to implement the demonstration statewide, but will take a phased approach to rolling it out that's based on correctional facility type and their readiness to go live with program requirements. In order to support and ensure successful implementation, Nevada is also seeking capacity building funding to provide startup funding, so that is one-time funding to correctional facilities and other partners to assist them in the planning and implementation of services. Next slide, please. This lays out the demonstration goals. I won't read them all, I'll just touch at a high level. But again, as noted, the purpose of the demonstration is to put forth a hypothesis and a list of goals and to evaluate effectiveness of the project against them. So the demonstration goals that Nevada has put forth include increasing coverage, continuity of coverage, and appropriate service uptake, to improve access to services for individuals prior to release and ensure that they're able to transition into the community successfully upon release, to improve coordination and communication between correctional systems, Medicaid systems, health plans, and community-based providers, to increase investments in healthcare and related services that are aimed at improving the quality of care for individuals in carceral settings. Again, improving connections between carceral settings and the community services that are available to them upon release, and to reduce the number of emergency department visits and inpatient hospitalizations among those individuals who have recently been released. Next slide, please. This slide gives you a snapshot of what individuals or which populations are eligible to receive services under the demonstration. Both adults and youth are eligible, but there are some differences between the criteria. So for adults must be Medicaid eligible adults, whether that's for MAGI or non-MAGI, who have one of the physical or behavioral conditions that are listed here. So a mental illness, a substance use disorder, chronic disease or an other significant disease, an intellectual or developmental disability, traumatic brain injury, or HIV, or individuals who are pregnant or up to 12 weeks postpartum. Youth are also eligible to receive services under the demonstration. That includes Medicaid CHIP eligible youth under 21 and former foster care youth up to age 26. Notably, there is no behavioral health or chronic condition criteria in order for youth to receive services under the demonstration. And also of note, DHCFP is not proposing changes to Medicaid eligibility standards more broadly via this demonstration application. Next slide, please. This slide puts forth which facilities will be eligible to provide services to individuals as part of this demonstration. Nevada, in line with legislation and the work that's been done since AB 389, is proposing to take a phased-in approach where in phase 1, all state prisons, all state-operated youth correctional facilities, and county-operated juvenile detention centers or youth camps will be phased in for the first phase. In phase 2, county-operated jails will be given the option to participate and to opt in over the course of a 2-year period. Notably, for county-operated jails that have this option in order to participate in the eligibility requirements, due to federal legislation, the Consolidated Appropriations Act of 2023 that requires all states to provide screening, diagnostic, and case management services to Medicaid or CHIP eligible incarcerated youth who are post-adjudication. Those facilities will be required because of that federal requirement to provide those specific services. Any facilities that house CAA eligible youth will be required to provide that set of services, and then will be given the option to provide the additional services that are covered under the demonstration. So just some specifics on what that opt-in may look like. Next slide, please. This slide will lay out the services that are covered under the demonstration. So the first services that are listed on the slide are required by CMS. They must be provided by states that implement the demonstration. These include care management services, medication-assisted treatment for individuals with substance use disorder in combination with counseling or behavioral therapies as clinically appropriate, and a 30-day supply of all prescription medications in hand at the point of release, consistent with existing Medicaid and CHIP state plan coverage. Additional services that have been included through AB 389 as are listed here. Those include physical and behavioral health clinical consultation services, prescription drugs during the pre-release period, so prior to an individual's release, laboratory and radiology services, and the services of a community health worker, which would primarily be related to post-release education and training for patient self-management of health conditions. And the note on the slide here just indicates that when assessing facilities' readiness to go live with these services, Nevada is asking for flexibility to allow facilities to establish service level tiers where all facilities that are participating will be required to provide the minimum set of services that are CMS required in the first tier. Facilities that house post-disposition youth would be required to provide those mandatory 3 and the clinical consultation service to comply with the CAA requirements. And then Nevada will work with other stakeholders to get input and engage on developing other service level tiers for the remaining services. Next slide, please. So of note, as it relates to the healthcare delivery system and benefits, the demonstration does not propose any changes to the Medicaid delivery system more generally as part of this application. Nevada is currently exploring whether these pre-release services will be delivered on a fee-for-service basis, or if Nevada elects to provide some or all services through managed care, it will memorialize this decision in its implementation plan, which will be developed after the application is submitted to CMS. With regard to cost sharing, Nevada currently does not apply cost sharing to any of its Medicaid members except for children and CHIP, and therefore no cost sharing will be imposed under this 1115 demonstration. Next slide, please. This slide gives a look at what the Medicaid agency, DHCFP, anticipates enrollment might look like under the demonstration. Based on the Medicaid eligibility requirements in the demonstration request that we were described in a previous slide, Nevada anticipates the impact on enrollment trends as detailed in the table below. As you can see, Nevada is anticipating a ramp up over time and estimates that by the final year of the demonstration, up to as many of about under 12,000 people may be eligible and enrolled to receive pre-release services. Next slide, please. This slide presents an overview of the projected expenditures over the 5-year demonstration period. So Nevada is projecting expenditures of approximately $85 million over the 5-year demonstration period. Notably, the authorities that are being requested in the demonstration do not represent new spending, but instead represent spending that would otherwise be expected under the Nevada Medicaid state plan in the absence of the waiver. Next slide, please. So just to level set here on the evaluation requirements that are required by CMS, Nevada is required as a component of the demonstration to arrange for an independent evaluation of the waiver's objectives and hypothesis that it wants to test through this demonstration, following the process that's outlined below. So Nevada will first submit the waiver application to CMS, which includes the hypotheses, and we'll take a quick look at those on the next slide. CMS will approve the waiver request, and then Nevada arranges for independent evaluation of the waiver hypotheses. CMS approves evaluation design, and then the independent evaluator moves forward with evaluating the demonstration, including by conducting focus groups, surveys, targeted interview, and analyzing data to inform required reporting to CMS. Next slide, please. Finally, these are the demonstration hypotheses that Nevada has put forth as part of their application. And you'll notice that they align with the goals that we spoke about at the start of the presentation. So Nevada hypothesizes that the demonstration will result in increases in Medicaid and CHIP enrollment of individuals not previously covered, and thereby would increase coverage and service utilization among individuals who re-enter the community after a period of incarceration. Nevada anticipates that the demonstration will result in increased access to physical and behavioral health services in the pre- and post-release period and improve health outcomes. And Nevada hypothesizes the demonstration will result in fewer emergency department visits and fewer inpatient hospitalizations. And as noted, the application includes a preliminary plan for evaluation. The hypothesis and the evaluation plan are subject to change and will be further defined as Nevada works with CMS on refining the evaluation design. Next slide, please. So we will, in short, be turning to our public comment, but first on the next slide, we wanted to present a quick overview just to level set on the timeline and next steps for submission. So the public comment period is currently underway. We are at our first public workshop hearing today, November 6th. There is also a public workshop hearing that is scheduled to take place a week from today, next Wednesday at 9. So if there are additional comments that you'd like to submit at that hearing, please do join us a week from today, November 13th. The public comment period will close November 24th, and then DHCFP will be working to review all of those public comments, record them, and respond to them within the application. So we'll be working to finalize that application for CMS submission and are targeting mid-December for submission to CMS. Following submission, CMS will conduct a federally required 30-day public comment period early in late December 2024, early 2025, and we anticipate that negotiations with CMS prior to approval will continue through spring 2025. Next slide, please. So again, one more reminder on the various ways that you can receive submit public comments. They must be received before midnight on Sunday, November 24th. They can be submitted via email, written mail. As is noted here on the slide, please just be sure to include section 1115 reentry services demonstration in the subject line. And we've also copied, again, for your reference, web pages where you can find additional information on the demonstration. Next slide, please. So we're going to turn now to hear from all of you with any questions that you might have. Just a reminder on how the logistics here will work. If you are participating via webinar, so you're on the Teams platform and you would like to submit a comment or ask a question, you can either use the chat box and drop your questions in there, or you can raise your hand on the Microsoft Teams toolbar and we will work our way through folks who have their hands raised in the order that they're raised. We'll shoot for that. All information that is spoken or that is received through the chat box will be recorded as public comment. So please share your name and agencies so that we can ensure, or organizations, so that we can ensure that that is reflected in the public record. If you're listening by phone, you can press *6 to unmute your line, or *5 to raise your hand. And we'd ask that you do it in the opposite order. So if you could raise your hand using *5, and then when you're called on, you can press *6 to unmute your line if you're participating by phone. So with that, I think that we can turn to comments. I think my colleague Sarah was also going to be helping me out with this, but we will start. I believe Kyle Lowe had raised your hand to submit a comment.
Hi, this is Kyle Lowe with CareSource. On page 9 of the notice, you say that you will release or publish the draft waiver application and a summary of the public comments. Do you know what date you're planning on publishing that?
So the full waiver application with the summary of the public comments, we're shooting for mid-December. So for the version that goes to CMS as its official submission, it will include a section that will record the comments, will provide the state's responses to the comments there. And so that will be posted mid-December. Yep. Leslie Nix, I believe you had your hand up next.
Hi, Leslie Nix with City of North Las Vegas. Will there be an opportunity for organizations to participate that are not county operated jails? So would city operated jails be eligible to participate?
I believe that the demonstration as conceived of now is county operated, so it would not be municipal jails or city jails.
If we're okay to move to some questions in the chat, the first question that we have in the chat is asking for clarification on the definition of post-disposition for juveniles.
Yes, so post-disposition would mean post-sentencing. So that's an individual who has been sentenced and they are post-sentencing.
Thank you. The other question that we have in the chat is, how will the success of these services be measured? If monitoring, what is the state currently paying out for these individuals without the services in place? Mm-hmm. Amber, I hope I got that correct.
Yep, and I'll look over at the chat as well so that I can be trying to see both. I think that, as we noted, the evaluation plan and hypotheses are still subject to refinement, but they will be included in the waiver application as what were laid out on the screen. And as we noted on the projected expenditures slide, it's anticipated that this would not represent new spending under the Medicaid, so it will be budget neutral. In other words, it wouldn't be any additional spending than what would be anticipated under the Medicaid state plan in the absence of the waiver. I see a comment from Elizabeth Flores, who's asking who will coordinate the screening, diagnostics, and case management for juveniles. I think that is still subject to ongoing design for DHCFP. So that is something that we can take back. We welcome your feedback on if you have thoughts or ideas on who might be best situated to provide those services, but we have not, the state has not yet confirmed that approach. But we'll be working to do that as we move forward with implementation planning. Leah Lamborn asks, where does the current targeted case management services provided by facilities currently fit into this initiative? That's a great question. I may ask to take it back or phone a friend if my colleague Kinda Sarafi is on the phone for this one, or if Michael wants to weigh in.
Yep, I think we are in our current state assessment trying to better understand the extent to which facilities are providing case management. We do understand that many facilities provide some level of case management for some populations. And we're trying to understand if what is being currently provided meets what the federal government is expecting, which is a care needs assessment and the development of a care plan, and then a handoff from the pre-release into the post-release. So we're in the current state assessment phase, and to the extent we can leverage what's currently happening, we want to, but we just need to have a better sense of what's happening, and we welcome any written feedback to the extent that there is information on the breadth of case management that's currently being provided that we should know about. We welcome that.
Any other comments or questions that folks would like to share? Michael, we're not in the room. I don't know if you've been joined there with anyone in person, but please obviously do let us know.
Yeah, there's no questions or comments from the room. Thank you.
Great. Give it just a minute or two more in case folks are collecting their thoughts.
We also welcome any comments positive to the initiative or any components of the features that anyone would like to comment on that they feel will hit the mark in terms of trying to impact continuity of coverage and access to services in the post-release period.
Kyle, I see you have your hand raised.
Yes, regarding continuity of care, I was curious, is the state currently leaning towards a fee-for-service schedule for pre-release services, or are they leaning towards managed care?
I'll answer that and say that's a very great question. And that is a design question that that takes a lot of time. Our understanding that other states that have come before Nevada have really tried to wrestle with what the best delivery system is. And we welcome any feedback and thoughts.
Leslie.
In phase 2, it's opt-in county operated jails. If you have low participation, is there a possibility to expand to other jails?
That's a great question.
Michael, do you have a thought there, or is that something we want to take back?
Take back potentially.
I think we will definitely take that back and consider. I know that Nevada has a different outlook from county to county, and so we hadn't really discussed citywide. Just thinking, coming from the north, we don't have a city jail, so really didn't put that in perspective. But we will definitely take that back.
Thank you, Leslie. That's helpful feedback. Anyone else with comments, questions? Happy to give you another minute. And as noted, we will be
I can
Yep.
take a stab at the question that Leah raised. So this is a pilot initiative, as Ally has positioned, and as CMS, the federal government, has put forward in its guidance. And per the federal government and per the waivers that were approved in other states, the pilot that we're trying to demonstrate is that if you provide a targeted set of services in the pre-release period prior to someone being released into the community while they're incarcerated, those services will help connect individuals primarily to behavioral health and physical health services once they're released into the community. And if they are getting the right services in the right setting, we could potentially avoid and offset individuals being served in emergency rooms, emergency departments, and get them. And rather than be hospitalized, we would have them get the community-based services. So that's the general objective that CMS, the federal government, has put out on why they're approving these waivers, because they do believe that there is a potential here to yield savings, right setting, services in the right setting versus emergency room, emergency department.
So, I'm sorry.
That's okay, Leslie. Feel free to chime in.
Okay. Leslie again with North Las Vegas. We have, I think, 6 or 7 different jail or municipal court combined with jail programs that are operating to try and align these kind of services with clients. So that what you're describing is what we're trying to demonstrate through grant funded programs right now. And
Excellent.
It's temporary grant funding, and the ones that we're finding are very successful. We'd like to see those continue in an ongoing way without gaps in service and gaps in staffing and things like that because of the nature of the grant fund time limited, funding limited effect.
That's excellent feedback. And that's exactly what we're trying to leverage, is this sort of stable Medicaid funding to provide this targeted set of services to support what you are doing now with, grant funded short term. We're trying to leverage Medicaid dollars for more stable, positive outcomes. So thank you. And Leslie, we'll be really very much interested in the work that's happening now as the state begins to design and get your feedback on what's happening and what's working well.
And this is Michael. Leslie, can you definitely put your information in the chat, contact information for further discussion?
Yes, thank you.
That's great. That's very helpful. Thank you, Leslie.
Wonderful. So if we're okay to turn back to the chat, one question that was raised around MAP protocols. These are typically designed for adults. So can participants submit feedback related to this requirement?
Yes, this design is going to work based on feedback on what's working well and where there's improvements related to all aspects of the demonstration. So absolutely.
Wonderful. We'll go to Kyle with his hand raised and come back to the chat.
With the release of the Nevada Housing in Lieu of Service pilot and the included eligibility for individuals transitioning from incarceration, have there been any thoughts or process planning towards linking those services so that we can also focus on the housing and post-transition release as well? Kind of like dual eligibility or, ways to streamline these programs since they are related?
Yeah, I can take that, Ally.
Yeah,
so
please.
It's a great, important point, Kyle. And the pre-release case manager that's providing services will do a care needs assessment and develop a care plan. And the care plan has to address physical needs, behavioral health needs, and social health-related social needs. And so that will be documented in a care plan. And to the extent that we can create policy, there'll be a connection to what's identified as a need from the pre-release to the in lieu of services that include housing supports in the post-release. We will endeavor to do so. It's a great point, and we will be sure to include that.
Agree. Very helpful. Thanks, Kyle.
Thank you so much. All right, going back to the chat, we have a comment from Chris raising, of course, down the road, but with respect to demonstration goal 2, are there planned activities to engage community stakeholders to provide these services, or will it just be the usual suspects referred to? So in short, plans to increase provider capacity.
So I'll start and say there is going to be a plan to have an advisory group meet and weigh in on all aspects of the design after the waiver is submitted and after we have gotten more track beneath us with CMS negotiation. And at that point, we are definitely going to be looking to understand who the providers are that can currently provide services and who are other available, because we know workforce is going to be a real issue for us in all aspects of this. So we'll welcome any feedback, Chris, that you have on this for sure.
Mm-hmm.
And I think I can answer the next question now that I'm talking around the one from Philip on how this has worked in other states. So great question. So there are 24 states that have either pending or approved waivers, but there are only 7 states that have approved waivers and only 1 state that has started this, and that is they just started in October of 2024, and that's California. So while there's half the country is pursuing this initiative, it takes a while to stand it up because it is complex. And California has only just a few weeks under its belt. So at this moment, we have not seen any data publicly shared and probably won't see it for quite some time until there is as more of a runway in California's implementation.
All great questions and very helpful comments. Any other comments or questions? Just one more minute. Okay. There we go. Thank you, Kyle. So Kyle notes in the chat, as a positive comment, I live in Indiana and we've been offering pre-release services for several years. It's been a huge benefit to the state in terms of behavioral health and SUD outcomes for post-release individuals. Thank you, Kyle. It's great to hear. I'm glad I gave it one more minute. Anybody else? Okay. Well, we really thank you so much for joining us today. This has been an excellent discussion. We really appreciate all of your comments. We'd encourage you. We will, again, as we noted, record them here. The chat will be recorded. The spoken comments will be recorded as well. So those will be included in the record. But we welcome you to join us next Wednesday at 9 a.m. For the next public hearing as you continue to mull over any thoughts that you have coming out of today's session, or if you have a chance to take a closer look at the full waiver application. And then again, welcome your written comments via mail or email up through Sunday, November 24th. So please do reach out. You're encouraged to submit additional thoughts and feedback. And we very much appreciate your time today. Thank you all so much. Hope to see you next Wednesday. Take care.
Thank you, everyone.